What's going on, my friends? Chris Peach here with episode 150 of the Money Peach podcast. Kind of crazy to think we've been doing this now for 150 episodes. Pretty crazy what we've done. But every year around this time, open enrollment time, I take a second and I do a podcast episode all dedicated to things that we're going to be seeing when it comes in an open enrollment period. So this year, I really want to focus on health savings accounts. They've been around since 2003. And more people are becoming accustomed. They're hearing the word health savings accounts, HSAs. And so what we're going to do in this episode is we're going to break down exactly what is a health savings account. I'm going to answer all the questions that you probably have about HSAs. And then I'm going to explain to you whether it's for you or not for you. And it's going to be really simple at the end of this episode to have an idea of, okay, is a health savings account a good idea for me? Is it a bad idea? And when open enrollment comes your way here in the next few weeks, you'll be able to make a decision. So let's jump right in. So what is a health savings account? Well, think of it this way. A health savings account is the one and only, get this, the one and only thing inside the IRS code that has a triple tax advantage. What I mean by this is think about your 401k. You put money in your 401k, money goes into the 401k, and it goes in tax-free. It grows tax-free, right? So there's two. But you pay taxes when it comes out. So it has two of the three, okay? On the other hand, you have a Roth IRA. So a Roth IRA goes in after taxes. So you've already paid taxes. It grows tax-free and it comes out tax-free. So a Roth IRA also has two tax advantages, but none of those have three tax advantages. So what if we could take and combine those two? What if we could put something that goes in tax-free, grows tax-free, and then comes out tax-free? And that's exactly what a health savings account does. It's the only thing out there that I've seen that has a triple tax advantage. Now, obviously, there's some caveats to that. We're going to explain this in this episode, but think of it this way. If you want to keep Uncle Sam completely away from your money, you want to have them completely away from your money, they don't get any of that money at all, a health savings account is going to provide that for you. It sounds too good to be true. Well, let me explain why they have this in the IRS tax code, why the government has this plan. Okay. So we've talked about it goes in tax-free, grows tax-free, comes out tax-free. So what is it? It's a health savings account. So which is real simple. It's for your health and it's a savings account. Okay. It can't be any more simple. Now, how does it work? So what happens is you open up a health savings account and anybody can open it. Almost all employers now have an HSA plan. Okay. But if you're not employed and you're self-employed or even you're unemployed, you can open one up at many of the different places. I'll recommend one here at the end of the episode that I think is really, really good. And I'll explain why it's good. But if you have one at your employer, I would start there. Okay. If you don't, then I'll give you an example here. So let's walk through this. How does a health savings account work? Well, a health savings account, you cannot open one unless you have what's called a high deductible health plan. So HDHP. Okay. So what is a high deductible health plan? Okay. So there's a few things you have to have in place for a high deductible health plan. So number one, you have to have a high deductible. The IRS sets the limits for those. So your deductible health plan for singles has to be $1,400 per year in 2020. And if you're a family, it's $2,800 per year, meaning your deductible before your insurance actually kicks in, your deductible has to be either $1,400 for singles or $2,800 for family. So that's one stipulation for a high deductible health plan. Number two is a thing called out-of-pocket expenses, okay? Well, I'll talk about that here in a minute, but the limits are pretty high. The limits are $6,900 for singles or $13,800 for families, okay? What that means is that's the maximum you could ever pay if everything went wrong with your health and you had to go see every doctor and every hospitalization, whatever it is, that's the most that you could pay out of pocket before the insurance 100% kicks in, okay? So follow along here for a second. I'm going to explain why I still think HSAs are just such a good plan, okay? So I talked about this. Who qualifies for an HSA? Well, any employee, anybody who's self-employed, and even if you're unemployed, you qualify for an HSA. However, there's some things you can't have in place. So you can't have healthcare somewhere else. You either can have an HSA or you can have healthcare somewhere else, but you can never, ever have it together, okay? Number two is you can't be enrolled in Medicare. So when you hit age 65, you have the option to enroll in Medicare. If you enroll in Medicare, then you can no longer contribute to an HSA. You can use an HSA if you've saved in the past. You just can't contribute to an HSA. And then number three is if you are claimed as a dependent on somebody else's tax return. So let's say you're a 20-year-old college student and you're a dependent on somebody else's tax return. you cannot open up an HSA. So those are the stipulations for who can apply or who can obtain a health savings account. So the next question is, so now we've broken down what is an HSA. An HSA is a savings account, but you have to have a high deductible health plan. We know now who qualifies for it. So here's what's really cool. Remember I said it's tax advantageous for you to have a health savings account. Money goes in tax-free, grows tax-free, comes out tax-free. Really cool, right? So just like with our 401k and our Roth IRAs, the government puts limits on how much you can put in there. Think about it. If you can put money into a 401k and it was deferred taxes, some of you out there will be like, I want to put in as much as I can. Well, the IRS sets limits on it. So there's also limits on HSAs. Okay. So here's how this works. If you are single in the year 2020, you're filing single. Okay. You can put in $3,550. Okay. It doubles if you're a family, $7,100 for tax year or for 2020 this year. So the rules are you put in 70, or it'll actually be next year, but you can put in $7,100. And then if you're over age 55, just like your Roth IRA and your 401k, you get what's called a catch-up contribution. So with the HSA, it's an extra $1,000 per year. So think about this. If you're a family, you're over age 55, you can actually put in $8,100 into this health savings account. It goes in tax-free, it grows tax-free, and it comes out tax-free. Now you're probably thinking, why does he keep saying growing? It's not an investment account, or is it? So yes, it makes sense. You put money into something and it's tax-free if you're employed, or if you're self-employed, it's tax deferred, which means at the end of the year, you deduct it from your income. Okay. So for example, let's say you put in the $8,000. If you make $100,000 at the end of the year and you're self-employed, it would show you made $92,000 because you're deducting the $8,000 you put into the HSA. Now, so let's think about this for a second. So where does the investment part come out? Okay. Well, here's what's really, really cool is, so this is a savings account. Okay. Which means that there are different ways that you can save. The most popular way that you can save inside your HSA account is you can actually invest the money in there. You can invest it yourself. You can have it professionally managed, but kind of like a 401k or a Roth IRA or a SEP or whatever you might be using, that money inside your HSA can actually grow in an investment. So the great thing about like a 401k plan is you don't pay capital gains taxes on the growth. Okay, so it goes in tax-free, it grows tax-free. Same thing with a Roth IRA. You don't pay capital gains taxes on the growth. It goes in after taxes, it grows tax-free, comes out tax-free. Same thing with an HSA. The money that goes inside the investment portion or the savings portion of a health savings account isn't taxed. It grows tax-free. So that's why I have some certain recommendations of which accounts or which places you open up an HSA if you're self-employed, because not all of them will offer the ability for you to invest and to grow that money into some really cool accounts. So we'll talk about that here in a minute. Okay. Also, another cool thing is almost all employers that have an HSA will actually put money into your account for you. Get this, it's free money. I just looked it up. On average, a family is getting about $1,200 a year free money if you have an HSA. Now, why is this? Why would the employer want you to do an HSA? Well, think about this. I've talked about this in the past, so I'll kind of do a refresher here. So you have premiums and you have deductibles. Premiums and deductibles, okay? And so your premium is the monthly amount you pay each month. The deductible is the amount you pay when something happens. So if you have auto insurance and you get in a car accident, your deductible is paid, but every month you're paying a monthly premium. Same thing with health insurance. So what happens is if you take the risk away from the insurance company and you transfer it to yourself, you are going to transfer that risk to yourself, but you're also, since you're transferring that risk, you're going to get a better rate because you're taking on more of that responsibility. Okay. So for example, let's just say you have a premium, and I have some numbers here we'll go over here in a minute, but let's say you have a premium with a PPO plan that might be $235 a month. Okay, for single coverage. Well, if you were to go do a high deductible health plan, your deductible would go higher, but your premiums would go lower. So you would actually save money every year in monthly premiums. Okay, so there's the risk versus the reward. When you transfer that money, or when you transfer the risk from the insurance company to yourself, there is going to be a savings for you. Okay, so for the city or for the state or for the company that you work in, if that has the HSA, if you're willing to take on more of that responsibility, the employer actually gets a better rate as well on the other end of that. So the employer is looking at it going, I would love my employees to move into the HSA because it's going to be cheaper. Let's entice them by putting money in their health savings accounts for them. So an employer here locally I looked at, they put in $1,000 a year. So that counts towards your contribution limit. So if you have, say, your contribution limit of $7,100 per year is what can go in the health savings account. That can be anybody putting in that. That could be you putting in there. That could be your employer. If your mom and dad or grandfather or friend, actually the IRS lets anybody put money into your health savings account. So it's the how much can you put in? The maximum is a combination of who's putting in what. So if your employer puts in 1,000 and then you have, 6,000, that means somebody else can put in $100 and you'd max that out. Okay. All right. What's really cool is you've probably heard about the flexible spending accounts, the FSAs. They've been around a long time. So people always ask me, Chris, how does it compare to have an HSA versus an FSA, a health savings account versus a flexible spending account? I will tell you, I am not a fan of flexible spending accounts at all. And here's the reason why. There's just so much more freedom with an HSA. Okay. The biggest thing is if you've had an FSA, it's use it or lose it. If you don't use the amount you put into it, it's the same same concept of tax-free money. But if you don't use it, you lose it, right? If you don't use it by the end of the year, you lose that money. So that's not good. HSAs roll over every single year. Okay. So I'm a big fan of HSAs over FSAs. Also, flexible spending accounts, they make you decide before the calendar year, how much are you going to put into it through that year? And it's fixed. You can't change it. Where a health savings account, you can go in there and you can change the contributions anytime you want. So you have a lot more freedom. So if you have an option to do an HSA or an FSA, it's a no-brainer. I don't recommend FSAs at all. I don't like them. They're too strict. There's use it or lose it, and there's no investment opportunities in it. So for me, I don't know why there would even be a reason to do an FSA now that we have HSAs, FSA, HSA. Okay. Another question I get is, so what are qualified medical expenses? Okay. So think of it this, okay. You could go to the IRS website and look it up. It's long list, but just in a nutshell, think of it like this. Okay. So if you need something that's medically necessary, okay, to prevent a sickness, to treat a sickness or an illness or an injury, it's going to be covered, whether it's dental, whether it's vision, whether it's, medical. But if it's not necessary, and I'll just go ahead and say this is the Money Peach podcast. It's my show. I can say what I want. If you want to go out and get a boob job, it's not going to be covered by your HSA. Okay. You can't use tax-free dollars if it's not medically necessary. Now, obviously there's some caveats there. If it's medically necessary as prescribed by a doctor and you talk to your CPA about it, then yes, you probably could do some things that are a little bit outside of the scope. But just think of it this way. If it is medically necessary, okay, including prescription medicines, vision correction, tobacco cessations, or maybe like an obesity, weight loss clinic or something like that, it is going to be covered inside the HSA rules, meaning you could pay for it with tax-free dollars. Outside of that scope, you are going to take a penalty if you use HSAs, okay? The penalty is steep. Okay, you're going to pay regular income tax, okay, on it because it's never been taxed. And then you're also going to pay a 20% penalty. So make sure before you use it, you understand. Now, if you go to the doctor or you go to the dentist or you're sick or anything like that, or prescribe medicines, you can use that. Okay, you can use the tax-free dollars. Outside of that, you're going to pay a 20% penalty on top of whatever your income tax bracket is. So keep that in mind. This year is really cool because of the CARES Act. The CARES Act has actually loosened up the rules a little bit. You used to not be able to use an HSA for over-the-counter medications unless it was prescribed by a doctor. Now, any over-the-counter medications can be used by a health savings account, meaning you get tax-free dollars to use for these over-the-counter medications because of the CARES Act. So that is something that's new that a lot of people aren't talking about. But yeah, it is something that's new. All right, so another question I get here is, what if I change jobs? The HSA is like your 401k, okay? It goes with you, okay? So if you change jobs, it is attached to you. You own that money, not your employer. Your employer can contribute money to that, but it's with you. So you could take that anywhere you want to go. Okay. So just like if you have a 401k at Fidelity and you leave your job that used Fidelity, you could roll that over to TD Ameritrade into an IRA or something like that. That money goes with you. Okay, a lot of people ask me this, Chris, what does out-of-pocket maximum mean? Okay, so it's kind of interesting. You're thinking, okay, I get lower premiums, so I save money, but I have this number up here that Chris just mentioned. Let's see, The out-of-pocket maximums are $6,900 for single or $13,800 for a family. So what does this out-of-pocket maximum mean? Okay. Well, it depends on your plan. So on average, I was doing some research here. On average, most plans will, after you hit your annual deductible for a year, they'll cover between 80 and 100%, but let's just say it's 90%. Let's just say on average, they cover 90% of all medical expenses after you hit your deductible. Okay. So there is that difference there of 10%. And we'll do a quick example here. Okay. So let's just say I put this example together. Let's say you're single and you have an annual deductible of $1,500, right? Which meets the rules, because the rules are, if you're a single plan, you have to have at least a $1,400 deductible, and you have a maximum out-of-pocket expense of $6,900. So you are officially inside the rules of a high deductible health plan, okay? Because you're at $1,500 for deductible, which is more than the $1,400, and then you're at $6,900 maximum out-of-pocket. So you have the high deductible health plan, okay? So you have an HSA now. So now you're going through life, and you're at a friend's house, and he dares you to go on the roof, jump off into the pool. Okay. And you're thinking it's February, and you're thinking, well, I don't back down from a dare. So you go to the roof, you run, you jump, you miscalculate, you land on the concrete, you break your leg. When the dust settles, you're stuck with a medical claim of $7,500. Well, we know right away that your deductible is $1,500, which means you're going to wipe that deductible out for the year right then and there. Okay. So your deductible, $1,500 wiped out. So that leaves you with a $6,000 balance. Okay. So you have the $6,000 balance. You look at your plan covers 90%, okay, of all medical expenses beyond your deductible. So if you do the math on that, you have 10% left. So 10% of $6,000 is $600. So this accident is going to cost you $1,500 as a deductible, plus another $600 as your out-of-pocket expense, going beyond the deductible there. So you're looking at about, what is that, $2,100? So that's a $2,100 check you're going to have to write. Now, here's what's really cool. If you have money inside your HSA, you get to use tax-free dollars. So let's say you're single. Let's say you're making $85,000 a year. That puts you in the 24% tax bracket, federal income tax bracket of 24%. So if you do the math on that, so you just saved right there on that $2,100 that you paid. That's tax-free dollars. So you saved about $500 and some change right there. So remember, the really cool thing is the tax advantages. Money went in tax-free, it grows tax-free, but if you use it for medical expenses, qualified medical expenses, it's tax-free dollars. So really, you look at that going, okay, I had to write a check for $2,100, but it was tax-free money, the money the government never got. So the more you make, if the higher income tax bracket you're in, the more savings you're going to get. So keep that in mind as well. As you make more money, as you jump into higher income tax brackets, you are going to be obviously saving a bigger percentage on this money that you use. Okay. Now, let's see here. Oh yeah, we talked about that. Let's see, anything else that was really important I wanted to mention. Okay, so think about that. Your premiums will lower if you're in an HSA. We talked about that. So your deductible goes up, your premium lowers. So here's how you decide if a health savings account is good for you. Okay, it's very, very simple. Is if you have an employer-sponsored plan, I would go there first, because almost always they will give you on average $1,200 for families, $600 or $750 average actually for singles, according to the latest research. So you're getting free money there. Okay, so include that in your calculation. So what you want to do is you want to look at what's the break even here. Okay, so we do an example here. We look at, okay, let's say I'm a family, my wife and I, we have 2 kids, and let's say the employer gives me $1,200 or gives us $1,200 into our health savings account. Okay, so that's $1,200 of free money. Then let's say I save, I don't know, $1,500 a year in premiums, okay, because I took on more of the risk. So if I saved, if I get $1,200 from my employer, plus I saved $1,500 in premiums every year. So that's a total of, what is that? $2,700. Okay. So $2,700, I'm already ahead. All right. Now you got to look at your deductible. Your deductible looks like it could be, minimum, it has to be $2,800. So we're close, $2,800. But remember, your deductible is tax-free. Your out-of-pocket costs are tax-free. So keep that in mind. The number one thing I recommend for people that have HSAs is don't use them. Don't use them. Do whatever you can not to use them. These are not health using accounts. These are health savings accounts. Now, by all means, if you don't have any other options, use the tax-free dollars for medical expenses. But the reason why these were designed is it's to take the government off. It's to remove the government's responsibility having to take care of expensive financial medical expenses later in life for the citizens and putting it on the citizens themselves, us, you and I. So they offer this health savings account and they give you these crazy tax advantages. It's the reason why it's the only thing that has a triple tax advantage. So you and I can open one up and we can start saving in these health savings accounts and we can start investing inside the HSAs, growing our investments like we grow our 401ks, and then we get to use them tax-free later in life. And guess what? You can also pay Medicare premiums when you turn age 65 with tax-free dollars that you saved inside your HSA. So the goal of opening an HSA is really to build that account, just like you would build your retirement funds. It's a retirement bucket strictly for medical expenses. And we all know when is the most expensive time for your health in your life? It's towards the end of your life. So it's a way to create a bucket so you can start saving money. Now, who is a health savings account not for? Okay, I would not recommend a health savings account if you have no money saved right now, because what's going to happen is January is going to happen. Okay, and you have $0 in the bank account, and it's Murphy's Law, right? What can go wrong will go wrong. January 31st, you're going to be at your friend's house. They're going to dare you to jump off the roof because you don't say no to a dare. You jump off the roof, you miss the pool by 6 inches, you break your leg. And we're going to go through that example where you're going to need to come up with $2,100. Well, if you don't have $2,100, then it's not going to be a good plan to be an HSA. You're going to be in a much higher risk. Now, if you have an emergency fund, you're living on a budget and you're doing those things, then yes, absolutely use a health savings account. People always ask me, what if I'm somebody who gets sick, or what if I'm all the time, or what if I'm somebody who never goes to the doctor? I think they're both for you. And here's the reason why. If you never go to the doctor, you never get sick, and you do this consistently year after year, if you're one of those people, HSAs are for you. They're no-brainers. If you're not going to the doctor, you're going to get lower monthly premiums that you're going to have to pay anyway, right? But then you're also going to be able to have that money deposited by your employer maybe, or if you want to invest inside there, which you should, it's going to be a win for you. But also, I have a friend who he has 2 kids that are really sick, and every year, they're in the last couple of years as they were babies, they were going through different medical procedures. And he told me that by mid-February they would hit the family deductible. And so he was like, the nice thing is after that, I was on the hook for only 10% of medical expenses from the middle of February all the way through the end of the year. So it was another win for them as well. So again, if you are somebody who goes to the doctor all the time or somebody who never goes to the doctor, I still think they're a win. I would say the only time I would push pause is if right now you're trying to build up an emergency fund and maybe in 2021, you don't know if you're going to have it ready. I would wait until the following year until you have a little bit more foundation. So I will put show notes in here. In one of the places I recommend, I remember I said this a minute ago, but there's a lot of great places out there where you can open up a health savings account. My favorite place is a company called Lively. And I'll put them up on the screen here. So the reason why I like Lively so much is because Lively, it's free if you're a family or individual. So if you're a family or individual, it's free to open an account. There's a lot of health savings accounts out there that if it's going outside of your employer, you're self-employed or you're unemployed, there's monthly maintenance fees. Don't mess with that. Go to a place where it's free. If you're an employer and you want to start this for your company, they charge, I think, $3 per employee. But if you're a family or an individual, it's free. Okay, so I love that. But they also have the option of investing. And through Lively, there's 2 ways you can invest. You can open up your own self-directed trading account, which is through TD Ameritrade, or they have another one where you can actually have a managed portfolio with very, very reasonable advising fees of 0.5%. So either way, it's a great way to go. If you want to manage it yourself, you can. So that's why I like Lively. It kind of checks all the boxes. It's easy to use. It's very user-friendly. It's free to use. And if you want to invest, you have those options to do a managed portfolio or a self-directed trading portfolio. So that's moneypeach.com/lively. And I'll put show notes and links to everything that I mentioned here. We'll write up a good show notes here where we have all the numbers. So you don't have to write all these down. You'll be able to see them all. And so thank you guys so much for listening. I hope this was helpful. If you guys have any question, leave a comment inside our show notes. We'll have a comment section at the bottom. You can find those at moneypeach.com/session 150. That's moneypeach.com/150. And we'll see you guys next week. Same time, same place with an amazing episode of the Money Peach podcast. Take care.